Wednesday, the 10th of March, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration once again. So thank you to Dr. Bird, Dr. Pisamai for the Thai language edition of the summary. As usual, today we had the daily CCSA meeting in the morning, and as I mentioned on Monday, next Monday, the 19th of the 19th of March, 2021, we'll be having the general CCSA meeting, wherein many measures will be proposed in terms of revision of the disease control zones, as I mentioned, and there will possibly be relaxation of inter-provincial travel as well. So all of the proposals so far that we have from various ministries in various areas and sectors will be finalized and approved in the general CCSA meeting that we have next time. So the factors to consider for relaxation of measures are very important, and we've outlined that. And Dr. Bird had outlined this in the Thai language edition. Some factors for considering the relaxation of measures would include the preparedness of government agencies in terms of implementation, preparedness of the private sector as well as cooperation from society and on disease control measures. So it's very important, and we're moving forward to relax and adjust according to the context and the situation that is evolving. Now the context, of course, is evolving. The situation is evolving for the better in Thailand. I can say that the overall situation remains under control. It's very good numbers, positive numbers. Worldwide, the numbers are getting better, although the death rate average worldwide is 22%, while in Thailand it remains less than 1%. And Thailand remains at number 116 in the world ranking. So just about masks first. It's very useful to wear masks, as we mention all the time, and these days it's useful for a dual purpose because of air quality as well. As you might see in the news, the air quality in northern Thailand is very unhealthy due to wildfire smoke in the past days, the PM 2.5 dust level. So doctors have advised people to protect themselves by wearing face masks while being outside. So aside from the pollution, it also, of course, can help us prevent the spread of the pandemic as well. And of course, the various types of masks that we had talked about earlier. So if you're visiting Chiang Mai, don't forget to take your N95 masks, and of course masks to prevent the spread of COVID as well. So if you live there, try and avoid outdoor activities. One information is about the Deputy Prime Minister and Public Health Minister announcing that Prime Minister Prayut Chan-o-cha and members of the cabinet are scheduled to be inoculated with the AstraZeneca vaccine on the 12th of March, this Friday. The Health Ministry has completed the mandatory quality check of the 117,300 doses of AstraZeneca vaccine. As you recall, the first batch was Sinovac. So this brand has arrived, and it will be inoculated for the cabinet members. It was sent to Thailand last month, and the Health Ministry has certified that the vaccines can be used on people who are above age 60, and preparing for the AstraZeneca vaccine rollout and inoculation this week. Now I say this because the leadership, in terms of the country's leadership, portraying the confidence in the vaccines that we'll be using in the country is very important. So this confidence in the quality of the vaccines that Thailand is acquiring. We've been procuring different brands, and this is AstraZeneca. So the Prime Minister and the cabinet members testing out the first inoculation is very important in terms of confidence for the use of the general public use in due course. So moving to the numbers for today, we have new confirmed cases, which is 39 cases, 13 from active case finding. We have 95 new recoveries. Total number of active cases still being treated is 509, as you see on screen. I won't go into the details of the numbers every time, but you can see on screen for yourself. The most important number is the top green box that you see every time we have the briefing. So 509 cases currently being treated. The number is getting lower and lower, which is very good. As I mentioned, the death rate worldwide average is 22%, but in Thailand it's less than 1%, around 0.32%. and even less when you talk about the first wave as well. So just some observations. First, the 39 cases that we have recorded new confirmed for today, I'll break that down into 21 plus 13 plus 5. So out of 39, 21 cases were detected in hospitals and healthcare facilities, mostly in Samut Sakhon. 21 plus 13. 13 cases are from active case finding from Samut Sakhon and Pathum Thani. In Samut Sakhon, still under investigation, and in Pathum Thani, mostly asymptomatic cases. So 21 plus 13, and then plus 5 cases from today are from overseas and in the ASQ already. So 21 plus 13 plus 5 makes 39 cases confirmed that we have for today. The last day of the bubble and seal strategy in Samut Sakhon is today, and therefore we have found out that around 60 to 70% of people in the bubble and seal strategy have antibodies and safe to return home, but still have to wear masks. So that is what we have discovered following the end of the bubble and seal strategy in Samut Sakhon, the last day being today. And in Samut Sakhon in particular, I can say that the situation is improving. Accumulated cases, particularly province-specific, in Samut Sakhon is over 16,684 since the beginning of the wave. And from the new wave, in Samut Sakhon in particular, over 15,000 venues have been tested, and more than 200,000 accumulated have been tested in terms of the active case finding. 200,000 in 1,500 venues in Samut Sakhon in terms of the active case finding. Now, active case finding is important for us, for Thailand, as I mentioned. The percentage of active case finding found COVID positive, it would be around 0.87%, not very high, but it's still very important for us to have conducted the active case finding cases, which had actually rooted out the various positive cases around the country or in the important provinces that have been affected. In other provinces, in the past 2 days, no new cases have been reported in Prachin Buri as compared to the previous days. The vaccine rollout in general has been making the provinces around the country safer. And we are also continuing to promote the good factory practices. And Dr. Apisamai mentioned, of course, the word also resurveillance. So that means that we are not putting our guard down, even though the numbers are getting better. Even though we have 509 active cases compared to well above many thousands in the past days, the numbers are getting very good, but we are not putting our guard down. So the word resurveillance is very important. We have tested, we have surveilled, but we'll do resurveillance as well. For example, various field hospitals remain open, and we will not end any project without being very sure that the cases will not expand once again. Now, for the various information about Samut Sakhon, I present that to you specifically because it's very important. It's a very important province that we have been focusing on. 200,000 cumulative active case finding people are tested, 200,000 in over 15,000 venues, and 70,000 doses of vaccines have been delivered to Samut Sakhon as well. So to summarize the overall situation in the country, health authorities continue to find new cases in various parts of the country. We have reported the provincial specific kind of information on screen that you see. The map of Thailand is getting better in terms of the color. I think we have a map to show as well, coming in due course. The overall situation continues to improve. So around the 4th to the 10th of March, around 66 provinces have not reported any cases of COVID-19 for at least 1 week. Now, moving on, there is talk about the shortening of the length of the mandatory quarantine system, wherein, if approved by the General CCSA meeting, it will apply to travelers in 3 categories. The first is non-Thai citizens who were vaccinated against COVID-19 between 14 days to 3 months prior to their arrival in Thailand and have tested negative for the disease. They will be required to quarantine for 7 days. The second category is Thai returnees who have been vaccinated against COVID between 14 days to 3 months before their arrival in Thailand. They also be required to quarantine for 7 days. So the plan is to lower the quarantine days for these categories. The third category, non-Thai citizens who have not been vaccinated but have a COVID-19 free certificate. This group required to stay in quarantine for 10 days. And travelers arriving from the continent of Africa, however, will still be required to quarantine for the full 14 days. Now, just mind you that this is just a proposal that will be discussed and approved and finalized in due course in the General CCSA meeting. Now, travelers from around the world will benefit from this in terms of the shorter quarantine period as we go along with the complementarity with the vaccine rollout and vaccine inoculation in line with that. So globally, although the numbers are getting better, we still have to be careful. But in Thailand, when they arrive, things might get more convenient. Now, I misspoke a little bit in the beginning about the global death rate. I mentioned 22. I was mistaken. Sorry, I misread that. It was 2.2% is the global death rate, which is on average higher than the Thai the Thai average death rate, which is less than 1%, around 0.32%. You might be wondering, it's close to Songkran, is approaching next month. So the CCSA is discussing with the various agencies, and that the Culture Ministry would determine the suitable measures for Songkran activities, whether splashing of water will be allowed during the festival. Details will be presented to the subcommittee, the daily CCSA meeting tomorrow, and finalized and announced very soon. The Culture Ministry tomorrow, and the Health Ministry, and the Tourism and Sports Ministry, actually, these agencies will be discussing these measures for Songkran with the very important emphasis on the issue of safety. So we've been hearing things about the vaccine passport, the vaccine certification. So officials have met and discussed with the World Health Organization on the proposal, and they focused on the criteria required for this document. The Health Ministry insisted that the use of the term vaccine passports must wait for the standards to be set by the World Health Organization. And the Health Ministry would only issue vaccine certificates. So it's very important in terms of the terminology. Vaccine certificates would be issued to those who have received 2 shots or two jabs. So the certificate can be issued in terms of vaccine certificate, but in terms of vaccine passport per se, if you use that term, it would have to have an international reference or standard, which is yet to come. So use the word vaccine certificate rather than vaccine passport. I think that's very important. But in preparation for the possible future vaccine passport or any new related measures, in terms of the Foreign Ministry, the Ministry of Foreign Affairs is ready to support any new measures with regard to the change in the certificate of entry format, which will reflect the details of the vaccination. So the Foreign Ministry is ready to support these new measures with regard to any change in terms of the documentation. The vaccination shots in certain tourist spots to boost the confidence and the local economies. The Culture Ministry and Tourism Ministry have joined hands to discuss and decided that to provide vaccines in designated tourism zone, the provinces with a lot of tourists as well, which include Got Samui in Surat Thani, Pattaya, Chonburi, Chiang Mai, and Phuket, and tourist spots that have received the first batches of Sinovac vaccines this month include Got Samui, Surat Thani, which have received 2,500 doses. Pattaya in Chonburi receiving 4,700 doses, for example, and the second batch distributed in June with Samui receiving 16,000 doses, Pattaya 50,000 doses, and the like. So the Permanent Secretary of the Ministry of Higher Education has revealed that currently more than 300 million doses of vaccines have been administered worldwide in 114 countries in the 3 months since December 8th, 2020. The vaccination rate per day has reached 7.93 million doses, while there are 3 countries with more than half of the population already been vaccinated. Israel, Seychelles, and the United Arab Emirates. The United States has topped the list for the high number of vaccination distribution, followed by China and the EU. So for Thailand, it's something that we're giving importance to, and we're going along. We're following closely the various developments around the world, and of course our own plan of vaccination within the country. Now, just some additional points. Just you can see on screen that I'll talk about the MOPROM application. This service, official line platform where you can make an appointment for the COVID vaccination. Emphasize again that the Thai government will provide the vaccines and distribute them without the need for reservations. So the service will help set the date and time for the vaccine inoculation appointment, and provides the serial number and lot of the vaccines. Also be used to follow up on the side effects that may occur in the first week and the first month after the first and second inoculation, as well as locating the COVID test centers in both private and state facilities. And just to conclude, you can see, I'll show something on screen now from the World Health Organization. They have introduced a new infographic called 3 Factors to Help You Make Safer Choices, to remind people of what to do when you are in areas with widespread COVID. So it suggests that 1, open air spaces are safer than enclosed spaces. 2, farther away from others is safer than being closer away from others. And 3, shorter time periods with others are indeed safer. And while online shopping is something that we've been doing during the COVID pandemic, of course. So while grocery online shopping may be options for many, here are some recommendations on how you can minimize the risk when you go shopping. The infographic you see on screen is quite useful and practical. So they advise first to reduce the risk of shopping outside by shopping outside peak hours. Second, before you go out, make sure to have all the equipment, sanitizers, and masks. 3, keep your shopping time short and make shopping list. I think that's logical. And keep at least 1 meter distance from others. Just small reminders in your daily routine, in your daily lives, which could decrease actually your chances of being infected with COVID. So I've summarized the main points, the main thrust of the Thai language briefing, the meeting that we had this morning, the plan that we have for the general CCSA meeting next week, and the numbers and the data that Dr. Pisamai had mentioned today. And I've added also some important information for the English language audience as well. So thank you very much for your kind attention. It's all I have for today, and we'll see you again on Friday. Please keep safe and keep strong. Thank you. สวัสดีครับ
กราบขอบพระคุณค่ะท่านณัฐพานุ นพคุณรองอธิบดีกรมสารนิเทศและรองโฆษกกระทรวงการต่างประเทศนะคะสำหรับคุณผู้ชมที่ติดตาม NBT นะคะในช่วงบ่ายวันนี้1ประเด็นที่มีการสอบถามเข้ามา